Hey, nursing students, welcome to your super fast, high-yield guide to antilipidemics. We're covering exactly what you need to know for your exams, and we're doing it quickly.
All right, let's start with the classic safety question you will definitely see. What common breakfast food can cause a really dangerous interaction with statins? Think about it. We'll get to the answer in just a minute.
So what are antilipemics, anyway? Just think of them as a cleanup crew for the blood, designed to lower those lipid levels like cholesterol and triglycerides. We're going to break down the 4 main classes you have to know. First up, the big ones. Statins. These are pretty much the champions of lowering cholesterol. They're the first line of defense, and they work by blocking cholesterol production right at the source.
A common one you'll see is atorvastatin. Its job is really straightforward but powerful. It blocks a key enzyme that the liver needs to make cholesterol. And what's the result? A big drop in that bad LDL cholesterol.
But here's the critical part. You have to watch out for myalgia, which is just muscle pain. It's not something to ignore because it can be a warning sign for a really serious condition called rhabdomyolysis. That's a severe breakdown of muscle that can actually lead to kidney failure.
So what's your job as the nurse? First, you're monitoring those liver function tests, or LFTs, like a hawk. And hey, remember that breakfast question? Here's your answer. Absolutely no grapefruit juice. It can cause toxicity. And your most important teaching point? Tell the patient to stop the drug and call immediately if they have any muscle pain. Okay, next up we have cholesterol absorption inhibitors. These guys work totally differently. Instead of the liver, they set up their defense right in the intestine.
The main drug here is ezetimibe. It works by blocking cholesterol from the food you eat from being absorbed in the small intestine. The things you'll want to watch for are joint pain, that's arthralgia, and potential liver problems.
So again, your number one job is monitoring liver function. This is especially true because these are often given with statins. That combination increases the risk to the liver, so you've got to be extra vigilant.
Let's move on to our third class, bile acid sequestrants. You can think of these as little magnets in your gut. They grab onto bile acids, which are made from cholesterol, and pull them right out of the body. Cholestyramine is the drug to know. It binds to those bile acids and forces them out in the stool. And if you think about that mechanism, the side effects make perfect sense, right? It's all GI-related: constipation, bloating, and gas.
As the nurse, you're looking for something pretty unique here, a deficiency in the fat-soluble vitamins. We're talking A, D, E, and K. Why? Well, they can get bound up and pulled out of the body too. And remember this absolute contraindication? Never give this to a patient with a bowel obstruction.
And finally, we have niacin. This one is kind of the HDL superhero. While all the other drugs are focused on lowering the bad cholesterol, niacin's big claim to fame is that it boosts HDL, the good cholesterol.
You absolutely have to warn your patients about the main side effect here, because it's intense. We're talking about a sudden, really strong flushing, itching, and tingling of the face, neck, and chest. It can feel really alarming, and this is a huge exam topic.
So what's the simple trick to help with that? Just tell your patient to take their niacin with meals. It makes a world of difference in reducing that flushing. And of course, you'll still be keeping an eye on their lipids, liver function, and glucose levels.
Phew, okay. That was a lightning-fast tour. So let's lock in the most important takeaways with a quick review. This is the stuff you absolutely have to know. For statins, it's all about the liver and saying no to grapefruit juice. For cholesterol absorption inhibitors, again, think liver function, especially when they're taken with a statin. For bile acid sequestrants, think GI problems and watch for those vitamin deficiencies. And for niacin, remember that taking it with food is the key to fighting that flush. And here's your final little memory trick to take into the exam. It's super simple. S for statins means stop the grapefruit juice, and B for bile acid sequestrants means watch for bowel problems. If you can remember that, you're in great shape.
You now have the core info you need to answer these questions and, more importantly, to keep your patients safe. Take a deep breath. You've totally got this.